Hey there. So I am driving east from Birmingham towards Atlanta, and we'll be, turning south here in another 100 miles or so, headed towards Miami. Going to drive to Lake City tonight, stay overnight, and then headed on to Miami. So just wanted to do a little update today, talk about my experience in Birmingham. You could see that at least around the hospital complex, they're doing things pretty well. It looks like the masking protocol is being followed. The social distancing appears to be being followed. I didn't actually go in the cafeteria because I didn't want to be in that enclosed space, but it looked like they had enough tables put up that they were keeping people far enough away from each other, so that's a good thing. So this morning, as I prepared for my drive, I want to take a look at Florida and see what is happening there. And I remember a couple weeks back when we were starting to see the surge in Florida and Texas, Alabama, Arizona, California, the surge from either from Memorial Day or the protests, not really sure which, but there was definitely something all along about the 1st of June that caused a pretty good surge in cases, and that surge has continued. It's starting to level off in some places, but it's going pretty good. And so for the last couple of weeks, you've been hearing all kinds of politicos out there saying, well, yeah, but where's the deaths? And a couple of weeks ago I said, you got to remember that a case today isn't going to turn into a death for another 2 weeks. And it turns out, if you start looking at the charts now for Florida, for Texas, for Arizona, for California, that 2-week trailing effect is happening. The deaths are starting to increase in those places, but you need to look at that in terms of the big picture, right? And the big picture is that in Florida, despite the increased cases, despite the fact that deaths are starting to increase, Florida, the mortality rate currently for coronavirus attributed is, right around 20 per 100,000. And if you've watched any of my other videos, 20 per 100,000 is kind of what I've established as a benchmark of like, is this a bad flu year, or is this not a bad flu year? So in Florida, they're getting right up to that number, right? And in Texas, it's actually a little bit better. They're not even close to that. They're down around 13 per 100,000. But Arizona is up around 30 or so per 100,000. So depends, and it certainly varies state by state. Definitely, since there's been a shift to a more a younger population in this new wave that's been infected. We've even been hearing stories of people who have intentionally become infected with it, either as a badge of courage or being impatient to get immunity and get on with their lives. You can, I think, see that in the declining death rate, and that's great news, really. So all of those same states, Florida, Texas, Arizona, California, they've all got death rates down around 2%, if not below 2% in some cases. But that's still, with hundreds of thousands of cases and thousands of deaths, it's still 2%, and 2% is a pretty significant death rate, considering the number of people in the population that could eventually contract this. None of the populations that have been studied thus far are even close to herd immunity, which is generally considered to be 60% or so. But there's probably a little bit of an inverse relationship that goes on with that too. So I think no matter what, as we get more cases, we will see decreasing contagion as we go. So hopefully that will be the case. So overall, the good news, I guess, is that none of these health systems have been overwhelmed yet. There's been a few instances where they've come pretty close, but if people get serious and wear masks, wash their hands, do their social distancing, try not to act like they're invulnerable, if we can keep the younger people who feel like nothing can kill them from getting infected and then passing it on to the older people in their lives, then we'll make good progress on this. And yeah, I totally support the idea that it's not about necessarily tamping it down to zero. You know, that'd be great if you could, but what we need to try to make sure we do is keep the growth of the contagion low so that our hospitals can keep up with it and don't become overwhelmed and need to refuse treatment to people who need it. So that's the update for today. Oh, very pretty lake over here as I'm on the road between Birmingham and Atlanta. Have a good day, stay safe, wear your masks, wash your hands, tell your loved ones to be careful. Bye.